Thank you for being a part of Let's Talk, Understanding Mental Health and Mental Health Disorders. My name is Kahla Coulter. Today, I will be defining mental health and mental health disorders while helping you assess your emotional well-being, unpack what is good mental health, and identify when support is needed to address mental health disorders. What is mental health? Mental health includes our emotional, psychological, and social well-being. Mental health refers to the maintenance of successful mental activity. This includes maintaining the ability to adapt to change, coping with stressors or the stresses of life, productive daily activities, and fulfilling relationships with others. In other words, how we handle stress, relate to others, and make choices. Mental health matters because our emotions, thoughts, and attitudes affect our energy, productivity, and overall health, which can lead to serious mental health problems or disorders such as depression and anxiety. Mental health problems can lead to issues such as our attention, ability to organize and communicate, experimenting with drugs or alcohol, engaging in risk-taking behavior, being hostile and aggressive, and hindering our relationships with others like family, friends, colleagues, etc. Good mental health can lead to increased productivity, increased happiness and satisfaction, and better physical and mental health, which is eating healthfully, exercising adequately, caring for your health daily, taking time for yourself regularly, sleeping, and managing stressful diligently. So the key components of mental health include thinking, feeling, and action. Thinking is a cognitive component of mental health. It is important to recognize your thoughts and to determine if they are reasonable for the situation. So ask yourself how you respond to your thoughts. Our thoughts produce feelings in us. Feeling is the emotional sensory component of mental health. Thoughts produce feelings. Thinking the same thoughts over and over in your mind will create feelings. Negative thoughts will create more negative feelings, and positive thoughts will create more positive feelings. It is important to recognize your feelings. It is important to understand where these feelings are coming from. It is important how you respond to your feelings. Action is the behavioral component of mental health. Thoughts and feelings result in actions. Actions can be healthy or unhealthy. Thoughts, feelings, and actions have impact. When you are assessing your emotional or mental well-being, ask yourself these questions. Do you have emotions or feelings? Do you address your feelings? When you are sad, do you talk it out? When you are happy, do you celebrate? When you're nervous, do you talk yourself up? What about the more difficult or uncomfortable feelings? Feeling scared or feeling hurt? Do you talk about or address those feelings? Raise your hand if you have physical health. Raise your hand if you have mental health. Have you felt angry in the past week? Have you felt sad in the past week? Have you felt happy in the past week? Have you felt stressed in the past week? That is your mental health. Mental health is your emotions. It is normal to feel a wide range of emotions, including negative ones. We all have mental health, just as we all have physical health. When negative emotions persist for a long period and get in the way of us functioning in our daily lives as we ordinarily might, that means our mental health is not in a good place and we may have mental health problems. Why don't we talk about mental health or our emotional well-being? Is it because we are uncomfortable or we don't know what to say, don't want to say the wrong thing? Maybe we're afraid of being called crazy. Could it be our culture or how we were raised to not talk about it because we might be weak? It embarrasses the family or it must stay within the family. Talking about mental health can be a difficult conversation, but we need to talk about it. All of us have mental health, and like our bodies, our minds can become unwell. People feel very uncomfortable, again, talking about mental health. The number one reason is stigma. People with mental health disorders can be stereotyped and discriminated against, and it makes people reluctant to admit that they are struggling with mental health difficulties, which can delay treatment and support. For some people, the impact of stigma is worse than the symptoms of their disorder. When we ridicule someone, we create a barrier that makes us think we aren't like that person. We want to believe we could never be. The truth is, it can easily be us. We are more frightened about having a mental health disorder than having a physical illness. to reduce stigma and discrimination. We need better education to teach people the facts about mental health disorders while eradicating the myths. Someone you know will experience a mental health problem resulting in a mental disorder. It is important to talk about mental health and get help early if things just don't feel right, just like we would for our physical health. So mental health is not. It is not going to a therapist or a counselor, which does not mean that you are crazy. It does not mean something is wrong with you. It does not mean you are a weirdo. It does not mean you can't handle your own problems. It does not mean you are weak. Mental health disorders are extremely common. Many factors contribute to mental health problems, including biological factors such as your genes, physical illness, injury, brain chemistry, life experiences such as trauma or a history of abuse, and family history of mental health problems. According to the U.S. Department of Health and Human Services, 1 in 5 American adults experienced a mental health disorder. 1 in 10 young people experienced a period of problem depression. 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. People with mental health problems are just as productive as other employees when receiving effective treatment. All mental health problems can be helped with support, therapy, and medications. The prognosis for the vast majority of conditions is very positive with the right help. In most cases, even those with long-term conditions can be supported to lead full and productive lives, including employment. There is a distinction between pressure, stress, and mental health disorders. Everyone feels under pressure sometimes, including me, but not everyone suffers the adverse effects of stress or a mental health disorder. One person's spur to action is another's nightmare and cause of meltdown. The ability to work under pressure varies according to what is happening in the rest of one's life. Life decisions can bring about a lot of stress or pressure. Worrying about these pressures is normal. When worrying begins to consume us and we start feeling very sad, hopeless, or worthless, this might be a sign of mental health disorder. A mental health disorder can occur when the brain or part of the brain is not working well or is working in the wrong way. When the brain is not working properly, one or more of its 6 functions will be disrupted. Those 6 functions are thinking, perception, emotion, signaling, behavior, and physical. Triggering the symptoms of thinking difficulties or problems focusing attention, extreme emotional highs and lows, and sleep issues. When these symptoms significantly disrupt a person's life, we say that that person has a mental health disorder. The symptoms of mental health disorders vary from person to person and from time to time. The disorders can be more or less serious and may change over time. There are various types of mental health disorders. The common diagnosis are anxiety and panic disorders, depression, attention deficit disorder, ADD, attention hyperactive disorder, ADHD, post-traumatic stress disorder, PTSD, and bipolar disorder. Additional mental health disorders or eating disorders, psychotic disorders like schizophrenia, personality disorders, obsessive compulsive disorder, and substance use disorders. Early identification, appropriate assessment, effective care planning, and appropriate treatment make a difference. Most people with identified mental disorders will learn to function positively and effectively in the community. So we talked about the common types, or I went over the common types of those mental health disorders, the ones that are easily diagnosed. The additional mental health disorders, again, are those eating disorders, are psychotic disorders like schizophrenia, the obsessive compulsive disorder, OCD, intermittent explosive disorder, IED, oppositional defiant disorder, ODD, disruptive mood dysregulation disorder, DMDD, and substance use disorders. People with anxiety and panic disorders suffer from constant worry that is much more severe than normal day-to-day anxiety. Sufferers experience chronic, exaggerated worry and tension that does not seem to have a specific cause. People with the disorder regularly anticipate disaster and often worry excessively about health, money, family, or work. They can even feel extreme worry for a cause that is hard to pinpoint or that is even non-existent. This makes it extremely difficult to relax. Anxiety disorders are the most common of mental disorders and affect nearly 30% of adults at some point in their lives. The worries of anxiety and panic disorders can be accompanied by trembling, twitching, muscle tension, headaches, irritability, sweating, and hot flashes. Sufferers may also feel lightheaded, out of breath, and nauseated. Severe anxiety can be very debilitating, making it difficult to carry out ordinary daily activities. Depression is a serious but treatable mood disorder that causes feelings of sadness and or loss of interest in activities once enjoyed. Depression can be categorized as a major depressive disorder or clinical depression. Some forms of depression are slightly different or they may develop under unique circumstances. Persistent depressive disorder is a depressed mood that lasts for at least 2 years. Postpartum depression is much more serious than the baby blues associated with that relatively mild depressive and anxiety symptoms that typically clear within 2 weeks after delivery, but is more a full-blown major depression during pregnancy or after delivery. Psychotic depression occurs when a person has severe depression with some form of psychosis, such as delusions, hearing things, or hallucination. Seasonal affective disorder is characterized by the onset of depression during the winter months when there is less natural sunlight, or now as we are adapting and adjusting to this new reality and the effects of COVID. Symptoms of depression can vary from mild to severe and can include feelings of guilt, sadness, hopelessness, lack of enjoyment in life, the inability to concentrate, irritation, sleep issues, etc. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Attention deficit disorder, ADD, attention deficit hyperactive disorder, ADHD, are those common mental health disorders affecting adults. Symptoms of ADHD include that inattention, not being able to keep focus, always on the go, as if driven by a motor, being easily distracted or does not seem to listen when being spoken to, hyperactivity, excessive movement that is not fitting to the setting, fidgeting with or tapping hands or feet or squirming in seat, difficulty organizing tasks and work, maybe a difficulty with time management, disorganization, missing deadlines, etc., and impulsivity, those hasty acts that occur in the moment without thought. An estimated 82.5% of adults have ADHD. Post-traumatic stress disorder, or PTSD, is an intense physical and emotional response to thoughts and reminders of the traumatic event. When people experience a major traumatic event, they may feel a sense of helplessness, serious injury, or threat of death. Major traumatic events can affect survivors, rescue workers, members of the media, relatives and friends of the victims, and those who have seen the event either firsthand or on television. Traumatic events or situations are not easy, and they may leave emotional scars that take time to heal. During this time, it is normal to feel a range of emotions. It is important to acknowledge those feelings, let them run their course, and allow for enough time to properly process the event. This is part of the healing process. Emotional responses to a traumatic event vary. People may exhibit feelings of fear, grief, and depression. Physical and behavioral responses include nausea, dizziness, changes in appetite or sleep pattern, as well as withdrawal from daily activities. Responses to trauma can last a few days, weeks, or months before people resolve their reactions to the event. Bipolar disorder is associated with episodes of mood swings, ranging from depressive lows to manic highs. The exact cause of bipolar disorder is not known. Bipolar 1 disorder is defined by manic episodes that last at least 7 days or by manic symptoms that are so severe that the person needs immediate hospital care. The manic episodes may include symptoms such as high energy, reduced need for sleep, and loss of touch with reality. Bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes. These depressive episodes may include symptoms such as low energy, low motivation, and loss of interest in daily activities. Mood episodes last days to months at a time and may also be associated with suicidal thoughts. Treatment for bipolar disorder is usually lifelong and often involves a combination of medications and psychotherapy. Psychotic disorders are severe mental disorders that cause abnormal thinking and perceptions. People with psychotic disorders lose contact with reality and experience a range of extreme symptoms that causes behavior changes, delusions, believing things that are not true, and hallucinations, hearing or seeing things that are not real, such as voices that last longer than 6 months and affect social interaction, school, and work. A common type of psychotic disorder is schizophrenia. Effective treatment, when delivered in a timely, coordinated, and sustained manner, can help affected individuals to engage in school or work, achieve independence, and enjoy personal relationships. Conduct disorder is a serious behavioral and emotional disorder that can occur in children and teenagers. A child with this disorder may display a pattern of disruptive and violent behavior that is long-lasting and have problems following rules that violates the rights of others, goes against accepted norms of behavior, and disrupts the child's or family's everyday life. Symptoms of conduct disorder vary depending on the age of the child and whether the disorder is mild, moderate, or severe. In general, symptoms of conduct disorder fall into 4 general categories. Aggressive behavior, behavior that threatens or causes physical harm, like fighting, bullying, being cruel to others or animals, using weapons, and forcing another into sexual activity. Destructive behavior that causes intentional destruction of property, such as arson, deliberate fire setting, and vandalism, or the harming of another person's property. Deceitful behavior, behavior that may include repeated lying, shoplifting, or breaking into homes or cars in order to steal, and violation of rules, going against accepted rules of society or engaging in behavior that is not appropriate for the person's age. These behaviors may include running away, skipping school, playing pranks, or being sexually active at a very young age. Many children with conduct disorders are irritable, have low self-esteem, and tend to throw frequent temper tantrums and are often unable to appreciate how their behavior can hurt others and generally have little guilt or remorse about hurting others. Intermittent explosive disorder is another mental disorder marked by episodes of unwarranted anger. It is commonly described as flying into a rage for no reason. It involves repeated, sudden episodes of impulsive, aggressive, violent behavior, or angry verbal outbursts in which one reacts grossly out of proportion to the situation. Signs of intermittent explosive disorder includes road rage, domestic abuse, throwing or breaking objects, or other temper tantrums. These intermittent explosive outbursts cause you significant distress, negatively impact relationships, work and school, and they can have legal and financial consequences. Treatment involves medications and psychotherapy to help control those aggressive impulses. All children are oppositional from time to time, particularly when tired, hungry, stressed, or upset. They may argue, talk back, be argumentative, disobey and defy parents, teachers, and other adults. Oppositional behavior is a normal part of development for 2 to 3-year-olds and early adolescents. However, openly uncooperative and hostile behavior becomes a serious concern when it is so frequent and consistent that it stands out when compared with other children of the same age and developmental level, and when it affects the child's social, family, and academic life. Oppositional defiant disorder, or ODD, is a behavior disorder in which a child displays a pattern of an angry or cranky mood, defiant or combative behavior, and vindictiveness towards people in authority. The child's behavior often disrupts their daily routines, including activities within the family and at school. Symptoms of ODD may include throwing repeated temper tantrums, actively refusing to comply with requests and rules, trying to ignore, annoy, or upset others, being easily annoyed by others, excessively arguing with adults, especially those with authority, being spiteful and seeking revenge, swearing or using obscene language, blaming others for their mistakes, saying mean and hateful things when upset, and having frequent outbursts of anger and resentment. These symptoms are usually seen in multiple settings, but may be more noticeable at home or at school. Disruptive mood dysregulation disorder, DMDD, is a childhood condition of extreme irritability, anger, and frequent intense temper outbursts. Children with DMDD experience severe impairment that requires clinical attention. The child will exhibit irritable or angry moods most of the day or nearly every day. Severe temper tantrums, verbal or behavioral, at an average of 3 or more times per week, and trouble functioning due to irritability in more than one place, like home, school, or with peers. DMDD symptoms typically begin before the age of 10, but the diagnosis is not given to children under 6, adolescents, or those over 18. Treatment is often based on what has been helpful for other disorders that share the symptoms of irritability and temper tantrums like ADHD, anxiety disorders, oppositional defiant disorder, and major depressive disorder. The warning signs of mental health disorders includes an increase in unexplained absences or sick leave, poor work performance or missing deadlines, increased use of alcohol, drugs, tobacco, or caffeine, frequent headaches and backaches, withdrawal from social contact, poor timekeeping, judgment and decisions, working slowly, constant tiredness or low energy, unusual displays of emotion, frequent irritability or tearfulness, difficult concentrating, appearing numb or emotionless, forgetting directives, procedures, and requests, and having difficulty with work transitions or changes in routine. The how to having good mental health includes talking, being open with people you trust about how you are feeling, exercising, looking after your body, getting fit or playing a sport, and eating healthy, calming, meditating, incorporating good sleep habits, turning off the phone or television early, learning a new skill, which is a great way to gain confidence, relating by spending time with the people you care about, contributing by giving back or helping others, getting involved or contributing to causes you believe in, creating, expressing yourself through music, art, drama, writing, etc., and congratulating, affirming yourself, being kind to you, or listing the qualities. Principles to living well or connecting with others, getting physically active and eating well, helping others, getting enough sleep, creating joy and satisfaction in your life, staying positive and taking care of your spirit, dealing better with those hard or stressful times, and getting professional help if you need it. You can support you and your mental health by stopping, thinking, understanding, seeking, supporting. Be vigilant in the same way as you would for any health issues. Don't be afraid to ask for help. Talk about it. Be aware of your own negative stereotypes and stigmatizing attitudes. Accept who you are. Seek further advice and information as needed. Relax and survive. We can support someone and their mental health by having open conversations about mental health, counseling, and therapy, which allows someone to feel more comfortable in asking for help. Making the commitment to promote mental health and emotional well-being for yourself, family, friends, and community, and being in everything that you do, including asking for help. The Social Emotional Learning and Culture Department supports the safe and secure learning environments that focus on the social, emotional, and cultural needs of every employee and student of Aldine Independent School District. Our hope is this training will help you understand what is mental health, recognize the signs and symptoms of a mental health disorder, and know what you can do to help yourselves and loved ones who may be dealing with mental health issues. Please visit the department website, for additional mental health resources.